Hello, everybody. My name is Andrew, and I'm happy to join Delilah and Jana in presenting on our research proposal, appropriately named Project K. We will be providing a brief overview of our purposes and goals, as well as a glimpse into what our intervention can potentially look like. Should we acquire approval to carry out our mission, we are hopeful that it will prove to be of substantial benefit for healthcare and for public health. For your consideration, here is Project K, Education and Destigmatization of Ketamine as a Therapeutic for Depression.
Thank you, Andrew, for that introduction. So, talking about the college experience as the background for this study. Of course, going to college is an important and exciting time for a young adult or 20-something-year-old, but it's also a time of increased stress, probably loneliness, depending on how far away students have moved from friends and family. According to the Healthy Minds study between 2013 and 2021 by Lipson et al., there was they showed a growing mental health crisis, a 50% increase over that 9-year time period. They studied students from 373 universities, and the mental health issues were mostly relating to depression, anxiety, non-suicidal self-injury, and suicidal ideation. As an aside, Native Americans or Indian Americans and sexual and gender minority groups were struggling the most. So a quote from a different study by Horowitz says, suicide is the second leading cause of death for people in the U.S. aged 15 to 24. While rates of depression, suicidal thoughts, and suicidal behaviors are high among all college students, research has found the risk of these factors to be higher among adolescents and young adults identifying as a minority, referring to sexual orientation, or gender minority, referring to gender identity. All right, so there are some more conventional mental health treatments, such as antidepressants, anti-anxiety medications, but they take about 6 weeks to build up to full efficacy and have various side effects like sleep disturbances and weight gain. And if people are trying to keep it hidden, then being outed by your pill bottle could be another stressor. Let's see, other therapeutics for depression and suicidal ideations would be counseling, group therapy, but those take a while to really start seeing the beneficial effects on symptoms. There's a newer, more novel therapeutic for depression and other mental health disorders, and that is ketamine. So it was discovered in the 1960s, and it's been used as an anesthetic and analgesic for a long time. If you've had surgery, or sedation, you've probably had ketamine. Scientific investigations as far back as 2000, even further back, started testing intravenous ketamine against a placebo saline or more recently other placebos to test the effects on depression in patients, in human subjects. And there's, even in 2000, there has shown significant improvement, fast acting within 30 days, and more current studies show within 24 hours. So one of the studies in 2021 about ketamine infusions, IV ketamine infusions, there were, compared to the placebo, definite improvements with depression scores on the Montgomery-Åsberg depression rating scale. and scores improved with more infusions. Let's see. There are some side effects with ketamine, but they are pretty transient. They are nausea, vomiting, and increased heart rate. So people with heart disease should not do ketamine therapy for depression. But in 2019, a nasal spray was given the green light by the FDA. It's a form of ketamine called S-ketamine. And if you Google it, you will find lots of boutique wellness centers that offer a variety of ketamine therapies via different routes of administration. So the overarching purpose of the study is to educate college students about using ketamine as a therapeutic for mental health or stress challenges, as well as to destigmatize ketamine as a therapeutic treatment. As I've already said, that there are some mental health challenges that college students face, and because of stigmas associated with mental health issues, there are likely stigmas to conventional therapies, but a fast-acting antidepressant or fast-acting way to decrease suicidal ideation could be very, very helpful to a significant minority of college campuses. So the research questions we present in relation to that are: number one, what is the current understanding of mental health and well-being challenges among undergraduate college students? And number two, what is the current understanding of ketamine as a treatment for depression and suicidal ideations among undergraduate college students? So in answering these questions, we should be able to better determine the approach of future research studies that are planned to incorporate actual ketamine treatments, intranasal or nasal, the nasal spray I mentioned in the previous slide, for those that might want to try it. So this part of the study, part one, is called Project K Investigation, and the next part, using the actual ketamine therapy treatment, is called Project K Implementation. But from here on out, for the rest of the of this study and this presentation, we'll just refer to the implementation as Special K, as Project K. All right. And our research team of 3 hypothesizes that the average college student is familiar with mental health and well-being that they and their peers face, especially since the COVID-19 pandemic, but they may not be very familiar with treatments for depression and suicidal ideations, especially ketamine. And they may not even know about ketamine, depending on their age and how much they've been exposed to.
To help guide our understanding of participant behaviors in our intervention, this research proposal is designed with the constructivism learning theory in mind. The constructivism learning theory can be described as an active learning experience that builds on pre-existing knowledge to help guide individuals on their healthcare education journey. The idea behind this theory is that individuals can essentially come to their own conclusions based on acquired information and would effectively end up putting them in a better position to make informed healthcare decisions. With this theory in mind, we believe that students that may be experiencing depressive symptoms could benefit from participating in our program designed to assess their most pressing concerns around the potential of ketamine therapy as a form of treatment.
Okay, so now we will be transitioning into our methods section of this presentation. To start off, we'll be discussing the design that we used for this program. So for Project K, we used a sequential mixed methods design, starting off with qualitative to quantitative. The qualitative data will be measured through focus group discussions, and these discussions will explore the nuances of students' experiences, perceptions, and attitudes towards ketamine usage and mental health. And these responses from group discussions will aid in the creation of the anonymous survey that we will use for our quantitative data. And the anonymous survey will assess the participants' knowledge, attitudes, and beliefs about ketamine, mental health, and stigma. And we really wanted to use a mixed methods approach because it'll provide more comprehensive insights into the perceptions of ketamine usage and mental health. It'll also enable the development of tailored interventions to destigmatize ketamine usage and then just promote well-being on this college campus. And just to note some variables that we have in our program. So for dependent variables, that would be the participants' knowledge, that would be attitudes and their behaviors towards mental health stigma and ketamine usage. And then independent variables would include differences in demographic characteristics, program exposure, and even previous mental health experiences.
So for recruitment for this study, it's in two parts, but the qualitative part is the first part, and we will recruit with posters on the entrances and exits to campus buildings, and also online with the Wellness Mental Health Center at the university website, and also with professors giving it a plug on the first day of classes, because the inclusion criteria include undergraduate students that are enrolled in at least one on-campus class. Of course, they need to be 18 years or older, and they need to have had a depression diagnosis, either self-reported or clinically confirmed, in the last, or on at least two occasions, or they need to have had an experience of suicidal ideation at least once. And they also, to be included, cannot have used ketamine for purposes other than for a surgical procedure. Exclusion criteria include a history of psychotic or schizoaffective disorder, any substance misuse, including psychedelics, any sort of illicit drugs, or misuse of prescription medications, alcohol, even marijuana can cause issues. And the last point is, for exclusion, is having received care support, been to rehab, something to that effect, for substance misuse within the last 6 months. So current or past, within the past 6 months, substance use issues. So there are, according to several studies, but citing Jilka et al. From 2021, these issues are contraindications for ketamine treatment, although some studies will say that schizophrenia may possibly be able to be treated with ketamine, but not today in this discussion, in this study.
Okay, so now we'll begin discussing data collection and measurement within our program. So for those who choose to participate in our focus group discussions, they will be instructed to meet at the Student Health Services on campus. And from there, participants will be randomly assigned into their focus groups and given a private room where they will be able to have their focus group discussions in a safe and private area. It's also important to note that these focus groups will be hosted by well-trained moderators in order to ensure that all of our participants feel comfortable and just to make sure also that the group discussions stay on track. And so these group discussions will generally begin with icebreakers in order for participants to get comfortable with each other, and then from there move into questions regarding our project and ketamine usage and mental health. And if you are curious to see what type of questions would be asked in our focus group discussions, we do have a link to an example of the type of questions we would be asking in our focus groups in Appendix B, which also will be presented later in this presentation. And then the anonymous survey would be distributed using university platforms. Specifically, we would send the survey to the student emails following the focus groups. This was just the easiest distribution option that we could have used. And from there, whoever chose to fill out the survey would be able to write their answers anonymously, and then we would be able to gather our data from there. And to ensure rigor throughout Project K, survey instruments would be validated for reliability and validity, and focus group discussions will employ well-trained moderators, and coding for qualitative data would involve inter-rater reliability checks. And Project K also strives to maintain a neutral stance, and we do this by providing evidence-based information on ketamine usage and its potential benefits, risks, and limitations. And especially in our group discussions, we would like there to be a focus on fostering open dialogue and simply dispelling misconceptions.
After we've gathered our data, then comes time to analyze. All discussions will be transcribed by a qualified research assistant who supports the focus groups, and relevant themes will be identified using Deduce software. The final thematic analysis will be inductively performed by our research team using an established analysis framework, which involves familiarization of raw data, identifying a thematic framework, indexing or applying the thematic framework to all the data by annotating the transcripts, charting or rearranging the data according to the thematic framework, and mapping and interpretation, which includes defining concepts, mapping the range and nature of phenomena, and creating typologies. To validate these responses, the analyses of themes will be presented in focus group follow-up sessions. Likewise, data gathered from the issued questionnaire will be ultimately analyzed using the SPSS software. Responses will be coded as necessary to identify and gauge the magnitudes of where the greatest concerns are regarding how ketamine is used. This data will be validated using the most appropriate descriptive statistics and running any statistical tests if necessary.
So regarding ethical considerations, we will get approval from Azusa Pacific University's Ethics Review Board for Project K. There will be focus groups, which will be researcher-led. And at the beginning of the focus groups, between 3 to 10 students, there will be informed consent documents signed before the focus group gets underway, and you can see those in the supplemental materials at the end of this presentation. There will be anonymous audio recordings, which will later be transcribed by a research assistant, and synchronous notes will be taken also by a trained research assistant. There is also in the supplemental materials, there is a focus group topic sheet with questions and protocols to follow that has all this information there. And then for part 2, the quantitative part, the protocols for the online surveys will follow confidentiality and security protocols that the university that we use has already for the wellness and mental health and other confidential information.
So now we'll begin discussing the estimated resources needed to conduct Project K. So the estimated budget for our program is about $40,000. And some of this budget will be going to human resources, such as public health experts, researchers, program coordinators, and moderators for focus group discussions. This team would collaborate in order to conduct Project K, develop educational materials, conduct interviews, and analyze the data, and overall assess the impact of Project K. And then some of the budget will also be going to tools needed for Project K, such as survey software for data collection, qualitative analysis software, and communication tools for team collaboration and stakeholder engagement. And then a good chunk of the budget would also cover various aspects, including personnel salaries, paying for the focus group facilities, the use of survey platforms, and material production costs for educational resources and promotional materials. But the proper allocation of our budget is essential in order to ensure the effective development, implementation, and evaluation of our program, which would ultimately contribute to our goal of destigmatizing ketamine use and promote mental well-being among college students. All right, so now we'll begin discussing the limitations and biases that may be present in Project K. So like any other public health initiative, Project K is not immune to limitation and biases that can influence our project's outcomes or its findings. So firstly, we'll start off with selection bias of participants. This is important to note because participants who choose to opt into the focus groups and decide to take the survey may have different opinions than individuals who opted out of our project, and this would affect the generalizability of the findings of our study. Next, we'll talk about self-report bias, as that may also be a concern, and this is because participants might provide socially desirable responses, especially in focus groups and surveys when discussing sensitive topics, like in Project K, how we are talking about mental health and substance use. So that may cause people to change their answers in order to have a more socially acceptable experience with mental health and substance abuse. And next, it's important to note recall bias, which could impact the accuracy of the participants' responses regarding their past experiences and behaviors. And this is really important in our focus group discussions. And it's also important to note that the qualitative data gathered from the focus group discussions might be influenced by social desirability bias or group dynamics, leading to the potential of underreporting of negative experiences or the overemphasizing of positive experiences of participants. So it's just really important to recognize and address these limitations and biases because it is crucial for interpreting the program's results accurately and for refining future iterations of a similar initiative.
Should our proposal be considered, we are hopeful for the future of what Project K can potentially offer to students and to a broader population. After being able to provide clear insights and education to students regarding ketamine as a possible therapeutic for depression, we would offer the opportunity to partake in local settings that may be administering ketamine to treat depression. Under Project K, this is not a requirement for purposes of gathering information and data from students. However, we would encourage those that feel that a trial would be of some sort of benefit for them after they receive additional education from us. That being said, this also leaves room to conduct additional research in the future. Our gathered findings always welcome additional interpretation or quantification in new and unique ways aimed at providing greater context to our goals. Also, following up with those that choose to receive ketamine as a form of depression treatment could explore several possible inferences and statistical relationships. Studies can be carried out to examine if depression levels change following administration of ketamine, and could also look to examine if attitudes and concerns about ketamine therapy change or if they remain the same. Thank you for taking the time to hear our proposal for educating and destigmatizing ketamine therapy to treat depression. As a separate attachment, you will find a document that includes detailed examples of a proper consent form, the focus group discussion guide, a survey, a ketamine fact sheet, and a sample for online recruitment to our intervention. We thank you again for your time and for your consideration.